If you're interested in hospital social work, this video is for you. Hospitals use both social workers and nurse case managers as part of an interdisciplinary team. In this video, I'm going to talk about the different roles between hospital social workers and nurse case managers. If you're interested in hospital social work, then you're going to need to understand how your role as a hospital social worker both differs and integrates with nurse case managers. Hi, my name is Tabby, and I'm an LCSW with over 13 years of social work experience in the healthcare field. And I'm here to bridge the gap between what you learn in social work school and the real world experience. Every hospital runs a little differently, and the information that I'm providing to you today is solely based off my personal and professional experiences. In my experience, there are a few different ways hospitals might have things set up. One way might be where social workers are primarily the discharge planners, and when you have nurse case managers, they're mostly doing like utilization review. So they're sending information to insurance companies to get approval. Another one would be where the social workers and the case managers are actually working the same job. So they split up a caseload and each of them just take a caseload and they're both doing the same roles. Then there's also where the nurse case managers and the social workers still split up the caseload, but social workers are primarily responsible for psychosocial issues, crisis interventions, and placement. Whereas the nurse case managers might be doing both the utilization reviews, or maybe they're not doing utilization reviews and they're doing they're doing assessments and they are coordinating care for a patient to discharge home, depending on if they're needing anything like home health, hospice, or home infusion services. So those are the different ways that I have seen and I have worked in hospital settings. Let's go ahead and break down the role of a social worker versus a nurse case manager when they are splitting a caseload, but they both have different roles. So as I mentioned before, the role of a nurse case manager would be to do utilization reviews, or UR. Utilization reviews are the evaluation of a patient's plan of care while they're in their hospital, and that is getting processed by health insurance companies to get approval so that the hospital can get paid, essentially. However, not all nurse case managers might do that job. It depends on the hospital. Nurse case managers might also do initial assessments. So they're going around and they're seeing all the patients and they're doing a brief assessment, or sometimes they're just doing a chart review to kind of take a look and see what the potential needs are of the patient. When nurse case managers take on the role where they're in charge of doing the home discharges, they're going to be coordinating home care. So they're going to be coordinating home health care, home hospice care, home infusions, maybe some home wound care, and any kind of home equipment. So that's typically what the nurse case managers do: utilization review, initial assessments, coordinating care for home services. Now, for the role of a hospital social worker in that instant, the social worker might be in charge of handling all psychosocial issues that arise, any kind of crisis intervention that happens, like, I don't know, suicidal ideation, a drug overdose, an immediate death, or substance abuse, acute mental health needs. So social workers are involved in that a lot of the time. They also do a lot of psychoeducation, and then of course they also coordinate care for placement. So going to a long-term care facility or a skilled nursing facility, rehab, even going to assisted living. They will coordinate those kind of cares for placement. Let's talk about how hospital social workers and nurse case managers actually work together. So in the instance where they're not necessarily having separate roles, but maybe they're working together as a team. So sometimes, like I said, you'll have a split caseload between social workers and nurse case managers, and both of them will do initial assessments. Some of the time, or a lot of the time, if you look at my video on biopsychosocial assessments, a lot of the time you're going to do a chart review first before you go in and do an initial assessment, because there are times where the initial assessment can be really brief, or some hospitals will allow you to just do a chart review to count as an initial assessment if there aren't any needs. Let's first talk about how hospitals are set up in regards to caseload. So some hospitals are service driven, meaning that you are assigned to a certain service or a team. So such as maybe you are working with the cardiology team, or maybe you're working primarily with neurology, or you're primarily working on trauma. And so your team is going to be whoever's on that service with you. Then there's other times where hospitals are set up by floor. So you might have different floors, and so you and a nurse case manager might be assigned to the same floor. Sometimes the caseload is split up between the social workers and the nurse case managers to do the initial assessments. And so that's when you're going to be doing a lot of the chart reviews, and you're going to do those biopsychosocial assessments, the ones that I talked about in my video. Make sure to check it out if you haven't already, on how to do biopsychosocial assessments in 20 minutes or less. In hospitals where social workers and nurse case managers have similar roles, both are going to complete those initial assessments, and they're going to start planning for discharge, because discharge planning happens day one, guys. So both people, both the nurse case manager and the social worker, are going to be starting the process of discharge planning in their initial assessments. I've also worked in hospital settings where initial assessments are divided between both the social worker and the nurse case manager after doing a thorough chart review. So they might both do a chart review, and then they divvy up the assessments based on social work versus home needs. And so if there are any psychosocial needs that are kind of coming up in the chart review, or that they're suspecting, or maybe there's a consult, then those will be assigned to the social worker. If they are ones that they might need home health services or just any kind of home services, then those will be assigned to the nurse case manager. But they kind of work as a team, and they decide how to divvy it up. And in other hospitals, nurse case managers might be assigned to be doing all of the initial assessments, and that social workers are only going to be taking care of any kind of social work consults that come through for psychosocial issues, crisis intervention, or placement. So in general, those are like the different ways that you might see a hospital be set up. But no matter how it's structured or set up, it's really important for both nurse case managers and social workers to have a good working relationship and collaborate together to make sure that the patient's needs are being met, especially for discharge. And although discharge planning starts on day one, because of the setting of a hospital, things can change so quickly. So you might have a discharge plan already and set up to go, but it could change the very next day. Heck, I've had it change within a few hours of my plan. So it's very fast paced. You have to be adaptable, and just know that things could change. And when you know that things can change, that also could mean, depending on how things are set up, where if you're primarily doing the placement discharges, and so let's pretend and say that you had a patient who initially they thought they were going to go home, and so everything was set up for home services, and then physical therapy and occupational therapy come in and they do their evaluation. They're like, oh no, they can't go home. They really need to go to a skilled nursing facility. Well, now the social worker is involved, and they have to start doing the coordinating of the discharge to go to a placement or go to a facility. So the discharge plan can happen so quickly that it changes. So that's why it's important for you to have a good working relationship with your nurse case manager, because you're going to have to collaborate together. Things are going to change constantly. So I know this was really brief, but I really hope that this video kind of gave you a little bit more clarity about the different roles of social workers and nurse case managers, kind of how they work together, and kind of what to give you a little bit of what to expect when you are entering the hospital field. If you guys found this video helpful, or you wanted to know more information, or if there are things that I haven't covered, please make sure to leave a comment below, and I will definitely address that for you. I really love when you guys leave feedback. It's so helpful for me. I love to produce content that's going to be helpful for you. Also, make sure that you like and subscribe to this channel if you haven't already, and make sure to sign up for the Medical Social Work Mastery newsletter so you can get tips, tricks, and resources on how to be an efficient medical social worker. Guys, thank you so much, and thanks for allowing me to be a part of your social work journey.